Okay, dear student, good morning. We are going to do the picture labeling for the second video of the S2. Posterior vitreous chamber, and we got here the ora serrata, and we are having here the three layers respectively. The most inner one, the yellow one, is representing as the retinal layer, then the choroid, and then the most outer one that we are having the scleral layer. This indentation here at this place we call that the fovea centralis, and this is a passage for the optic nerve here, and here we are having the optic disc. Here we are having the optic disc. So next go to the next picture here. That is the inner ear picture, in which we can see here first of all the facial and the vestibulocochlear nerve passage. Okay, so respectively need to remember. Here we go the cochlea, and inside the cochlea we can see very clearly the cochlear duct over there, and above that we can see here the semicircular ducts, and these two sacs, saccule and utricle. We can see the three bones here in the middle ear, the malleus incus and the steps. We can see here the oval and the round windows in the wall. We can see the eardrum over there. Okay, we can see here pharyngeal tympanic tube. Let's go to the next part. We got here the dural layers and also that the partition over there. So first of all we can start here the dural layer. We are having the dura mater is two layers here, the meningeal, dural, and the periosteal. We got here the arachnoid mater. We got here the pia mater. On another side, that if we see that here the extradural space between the bone and the outer layer of the dura mater, we got here the subarachnoid space. We are having in the falx cerebri. We got here the superior sagittal sinus. We got here the arachnoid granulation and the cerebral artery and the veins over there. And can also be asked about this, the external and the internal compact bone, and then in between spongy bone diplo as there. So pay attention on this part. Let's go to the next picture. The next picture is talking about the neck muscle, suprahyoid and the infrahyoid. What muscles above the hyoid bone we can see, as we are having here digastric muscle with this anterior and the posterior belly. We got here the mylohyoid muscle, and after that we are having the stylohyoid muscle. And we got another muscle under this but is not present there. We call the genohyoid, which is not present in this picture. Next we can see the infrahyoid muscles. In the infrahyoid muscles we are having here the omohyoid muscle. We got here the sternohyoid muscle. We got here the thyrohyoid muscle, and we are having the sternohyoid muscle here. We can also be asked about the vein, that is we are having the internal jugular vein and the common carotid artery with its two terminal branches as the internal external, and here thyroid gland, trachea, and some other structures or bones could also be asked. Next we are having the transverse section of the neck, in which you need to pay attention on the structures here. So first of all, the most outerly we are having the investing layer over there, and outside the investing layer anteriorly we are having the platysma muscle. Then we are having here the infraheart muscles over there, and externally we got here the sternocleidomastoid muscle over there. We are having here the trachea, both sides of trachea. We are having the thyroid gland. Posterior to trachea we are having the esophagus. We got here the internal jugular vein and the common carotid artery, and posterior to that we are having the vagus nerve. Okay, and then we are having here the fascia around the tracheal part. This yellow color is representing the pretracheal fascia. Around this vessel is representing the carotid sheath, and the posterior part of this, here at this place, that posterior part of the pretracheal sheath or layer we are having here, we call that buccopharyngeal fascia. Then we are having here the vertebra, inside the vertebra the spinal cord, and then we are having here the spinal nerves, and here we go the 3 Sacchini muscles over there, and then we are having the posteriorly, this is the trapezius muscle. Okay, so around this part here, the pink color line around this, we, as it is having the mainly the vertebra here, so this fascia we call that prevertebral fascia, or the layer of that. So pay attention on it. See you in the next video. Thank you very much.